What we're trying to do is develop systems that can train people to reach the pinnacle of their capabilities without having to consume expensive real resources. Hi, I'm Adrian Smith, Managing Director of Rheinmetall Defence Australia. Well, obviously modern operations of any defence force are extremely complicated. In a simulated environment, we're able to safely exercise all of the functions and the skills that are necessary at a fraction of the cost.
From a health industry perspective, we're really looking at patient safety. And what we're trying to do here is improve patient safety, reduce the morbidity and mortality. Hi, I'm Dr. Simon Patton, and I'm the Director of Simulation at the University of Adelaide School of Medicine. We're able to give staff the ability to try out the equipment, learn the equipment before it comes onto the wards, so they don't make errors with new pumps, new defibrillators. We also can feed back to the actual developers of medical equipment on their ergonomics, how this button is in the wrong location. It's led to multiple errors within the clinical simulation facility.
What we do is we provide an environment where we can run scenarios covering the full range of what people need to be able to do in a completely safe way. Hi, I'm Tony Mildred, Business Unit Manager Training and E-Learning with SIDAC. The rail environment has a lot of risks associated with it. You've got rail vehicles moving around, they're heavy, they're dangerous, they're quiet with electric trains. And it's not really safe or convenient, given that you're running a public service, to put people in that environment just to do training.
We know that human error is a huge factor in safety incidents on civil construction sites. So using simulation to address some of those human issues should enable industry to be a safer place for new entrants. Hi, I'm Victoria Griffith. I'm Interactive Learning Manager at Civil Train SA. If productivity is measured by your inefficiency in your processes, and simulation allows you to monitor and evaluate those inefficiencies and then address any gaps you've got, obviously productivity is going to be increased. So whether that's in civil construction, whether that's in mining, whether that's in health, those benefits can be realised across any industry, I think.
Simulation is a fantastic productivity tool. If you can train your people to have the right skills to do the best that they possibly can with the equipment they have available, you're going to maximise productivity.
It's a new teaching modality, and so it's had to go through quite a robust assessment and validation. We know that the traditional modes of teaching through didactic lectures and small group tutorials miss out on a massive swathes of actually students and health professionals learning how to actually do the task, how to get hands-on.
As we see more young people entering the industry, we're finding that their expectations of how you learn and the learning environments are slightly different.
The simulators won't do the training for you. You really need to make sure that you've got sound pedagogical models, that you've got experienced trainers and really clear session plans with clear learning outcomes.
You need to be clear of what you want to achieve by performing these simulations, not get sidetracked by the technology. The technology is fantastic, but it's the tool.
South Australia's got some wonderful companies that really are at the cutting edge. You know, we have the critical mass in Adelaide, and we have a small community that can really leverage off of one another, and I think that gives us all enormous opportunities.
There's a great base of engineering talent in South Australia. We're lucky that we have some really smart people to choose from.
Together we can work to start to develop and commercialise great new products and really put South Australia on the map globally.